Hi, my name is Rodito Patidungan from St. Agustin School of Nursing in EO branch. Today I'm going to perform the infant vital sign. Infant vital sign include respiration, breath rate, temperature, weight, length, and chest size. The materials we need to gather was infant stethoscope, measuring tape, a thermometer, a scale, and a watch, and a pen. For respiration, before we begin, let's perform a proper hygiene. Do the hand wash or sanitize all the materials. We will start the respiration when we see that the infant is lying calm and nice. Normal respiration rate for an infant is 30 to 60 beats per minute. Remember that infant breathing pattern is irregular. They have this periodic breathing. Where they can breathe, they'll stop for a second. To count the respiration, we need a full 1 minute. To count the rise and fall of the chest. Also checking the nostril to make sure no nostril flaring present. Look around the chest that no chest restrictions present. To check the respiration, you need to put your fingers over the baby's abdomen and you start counting a whole minute of the breath. For heart rate, wanna make sure you use the appropriate size of stethoscope. For the infant, normal heart rate is about 190 beat per minute. After 1 month, the infant rate is 90 to 180 beats per minute. To count heart rate, we're going to use the apical pulse. We're not going to use the radial pulse like how we do in adults. To find the apical pulse, what you want to do is you want to find the fourth intercostal space. Now, on an adult, remember, it was the fifth intercostal space at the mid-clavicular line. But for the infant, it is the mid-clavicular line. So you want to find the clavicle, and then we have the breastbone. And we're going to go down and we're going to pull in the between between the ribs and we're going to fourth space. Count the ribs to fourth and we're going to just the lateral to find the clavicular line. So we're going to go about the right. Where the apical pulse is on our infant and we're going to place our stethoscope there, and we're going to listen for 1 full minute for the infant heart rate. Can have a sinus arrhythmia, where is irregular because the heart rate can be affected with the respiration. I'm going to count 1, 2, 3, 4, fourth space, on the right side, and place the stethoscope and start listening the heart rate with a full 1 minute. To check the temperature, we will check it via axillary route. So we are going to place the thermometer tip in the armpit of the infant. The normal temperature of the infant can vary anywhere between 97.5 Fahrenheit or 99.3 Fahrenheit. Make sure you turn on the thermometer before you place in the armpit of the infant. Wait until the thermometer sounds beep. The time you can remove the thermometer and check the reading of the thermometer. That's the temperature rate of that infant. Now we're going to check the weight. To make the weight of the infant, we need to remove the clothes and soak diaper. A dry diaper does not matter. So place the infant on the scale and take the weight. The infant weight for the newborn is 7.9 pounds, which shows that gain a good weight after 2 weeks. Okay, that's normal. Now we're going to measure the length. To measure the length, you will be needing the assistant to help you. Move the baby to the place where you can measure. You need a pen and a paper for a marking. Lay the baby back on their head. Mark their head with a line, and then we need to straighten the legs and extend it outward. Make sure it's standing straight and mark. Take the tape measuring and measure it. Now we're going to the head size. Measuring head circumferences, you need a measuring tape and measure it by the centimeter. And the normal head circumference of the infant is about 33 and 38 centimeter. We are going to put the measuring tape around the largest diameter of the head. To do that, we're going to place a little be above the eyebrow. So we're going to wrap it around most prominent part of the head at the back. Remember, the upper eyebrow. And gently just lift the baby head up and put the measuring tape around. For the chest size, same measuring tape we're going to use. Well, we measure by centimeter. We will wrap around the baby chest and use the nipple as your guideline. Normal infant circumference about 1 and 2 centimeter less than the head. And that's how to take the infant vital sign of the baby.